guys, what's up? It's Dr. Angelica Napolitano here, owner of Optimal Physical Therapy and Wellness and creator of the Golf Doc Pain Elimination and Injury Prevention Support Group. Today I'm going to show you part 1 of my hip series, and in part 1 we're going to be assessing hip internal rotation. So it's really important to find the limitation in that hip, in that range with internal rotation. Okay, so the first thing we're going to do is we're going to do an active test. So you or your patient will be sitting just like this, and you're going to tell them to rotate their knees in and their ankles out. Okay, so just like that, and then back. You can grab some alignment sticks if you have those on you, and what you would do is place them right on the top of the foot, going up the shin bone, right? And then gives you a little bit of a measurement there. But it's best to use something that has numbers, like a goniometer, to measure the actual range of motion through a number measurement. That'll give you a better idea of the range of motion they have as according to the norms. So the norm is 45 degrees. However, most people don't usually have that. They have upwards of like 30. Pro golfers have at least 45 degrees, and some have upwards of 60. So that's very, very optimal. And internal rotation, as we know, is very important in our swing to get that hip to rotate, especially during the downswing. Because if we're not getting that hip to rotate as it should, we're going to sway and slide. And that's just not optimal movement for our golf swing. It will not produce consistency and power and torque. So for this passive test, you're going to have your patient or yourself lay flat on the table on their stomach. Okay, bring the legs up and let the ankles just fall out to the side like gravity assist. And as you can see, my right one goes out much more than this left one. Again, you can measure with alignment sticks, golf clubs, a goniometer. Another good way to assess this would be to film yourself or take pictures or have someone else do that for you. The last assessment, you're going to be in a 90-90 position like this. Okay, so my right leg is in internal rotation. If the patient or yourself is kind of listing to the side of the opposite side of the leg that's in internal rotation, that's a positive test that you're really tight in that internal rotator. And also if you kind of lift up and you can't get your pelvis back down into a seated position, that's another indication as well. So then you want to switch, do the other side. And as you can see, again, this left hip is coming up way more, and I'm listing to the right way more than I did when the right leg was in internal rotation. So again, that proves when I was doing it in sitting, when I was in prone, laying on my stomach, and in this 90-90 position, all three were positive that the left was much tighter. So that's how you can assess some hip internal rotation. If you have any questions, please feel free to reach out to me. Definitely want to get assessed by a physical therapist for accuracy and a good plan of care to treat that internal rotation limitation. So stay tuned for part 2 coming up soon.